it's a award-giving body that recognizes the best of cancer care provider in the Asia Pacific. You have to apply for it. So you go through a process to justify your standards and your processes, and if it's at par. And then I felt that we're ready after 5 years. So this is our 5th year operating as an oncology center, and we decided that I think it's time for us to be recognized. So I've trained abroad, and then every time that there's an award, it's always been Singapore, Malaysia, and then I said maybe it's time for the Philippines to be recognized. So that was the motivation. Since anyway we are giving medicines or chemotherapy that's at par international.
Usa kay mga factors Doc nga reasons nga napilian ang ARC
So
for
it's
this
more
award?
of how resourceful we are. You know how difficult it is to render oncology service in the Philippines. So it's not because we can do it on our own. It's more of alliances and collaboration. That's the key. So not all the time that we have the resources from the Philippines. So we still ask help from Singapore, for example, like the molecular profiling, proper diagnosis, and if there are medications that we need to import, then we have to provide it to the cancer patients. So the idea is that if there's a treatment available and you know that it's good, it's going to prolong the survival of the patients, it should not be a reason why you cannot give it because we're in the Philippines, or I cannot do the test because we're in the Philippines. So I mean, the idea is that hopefully in the future, we don't have to say it's not in the Philippines, we'll just content with whatever we have. So that was the motivating factor, and hopefully a legacy that I can give to the practicing oncologists.
Did you know ba Doc kung pila ka buok ang nag-apply for this category?
All those winners also applied for the same category.
The same category.
If they're within that particular factor or item of award. My goal is to get the cancer center of the year, because when you talk about the cancer, it's a comprehensive cancer center of the year. It includes surgical oncology, medical oncology, radiation oncology, and palliative care. So I'm a medical oncologist, so we started with medical oncology first. So once we get recognition with medical oncology, maybe we'll level up to getting all the
What's the timeline for your application for cancer?
It's difficult because you have to establish linear accelerator, you have to establish day surgery, and it has a lot of factors, like even pathology also. So maybe you have to find someone who can head the radiation all, the surgical all, and then maybe you can be able to do it.
Thank you, Doc.
Is there any other hospitals in the Philippines competing for that specific award?
So the thing is, we are trying to standardize the cancer care provision of care here in the Philippines. So actually because we won, and then it's the first time that the award-winning body actually recognized the Philippines, and so they conducted somehow like a convention or a conference to be able to identify, also invite the rest of the big institutions to join and participate. So sometime June, so I actually delivered the talk and speech about how accreditation is very important, because then you'll be audited whether your practices are at par with international standard, at least. So it was participated by it was done in Manila, and it was participated by big hospitals. So hopefully they will also apply later on, and then at least we can compare head to head within the Philippines.